more choices, more competition, and in many cases, lower prices. Most uninsured Americans will find that they can get covered for $100 or less.
Will I, in fact, have more affordable health care?
I don't have no medical insurance or anything to get my medicine, so because right now, we, the people, are suffering. We are.
I lost my jobs at work, lost my health insurance. This came about, and I said, this may be my hope and my prayer that I get health insurance.
You're hearing stories from people who showed up at an exchange in Long Island today to learn about and sign up for the program. And again, we need to remember, we were talking about more than 40-some-odd million Americans without health care when this whole process and whole debate started here. So I don't think anyone debates that there was some perfect system in place that has now been turned on its ear with Obamacare. Imperfect, whether you support it or oppose it here, that was a reality. But today is a different reality, October 1st, and it is the first day of open enrollment under this new plan. But what does that mean? It means you're now free to start signing up for health insurance under the Affordable Care Act. Now, here's how much Americans get their health coverage right now. If you get health insurance through your employer or the government, like about 80% of Americans, you don't have to do a thing. It's the remaining 20% that are impacted. Now, if you're a family that makes less than $31,000 a year, you can now get free Medicaid. That takes care of about 17 million of the country's 60 million uninsured. But if you're someone who doesn't have private insurance and doesn't qualify for Medicare or Medicaid, you have to go buy health insurance from an exchange or there's a penalty. And that is what has been opened up today. The exchanges are expected to take care of about another 22 million of that balance of the 60 million people who are currently uninsured. So what happens if you don't purchase insurance? Well, you got 6 months, and after that, you're going to have to pay a $95 penalty. It'll be deducted from your tax return, and the penalties will increase with successive years. So what else does Obamacare do? Well, here is an answer, at least part of the answer. Insurers can no longer discriminate against people with pre-existing conditions. Young adults, anybody up to 26, you can stay on your parents' plan. Insurers, if I can say this in English, must pay for some services that used to be optional, and included among this prescription drugs, maternity care, mental health services, as well as emergency care. Yearly out-of-pocket fees, they're also limited under this, and starting in 2015, workplaces with more than 50 employees must provide insurance to full-time workers. Obamacare, I think even the White House would admit, is not perfect. It still leaves 20 million Americans without insurance, and additionally, 22 states have refused. They've accepted the federal money, they refuse to take the money from the feds in order to insure more poor people. If you are poor and live in one of those states, you may be out of luck. I stress may because you could still opt in. Some, they're concerned about longer wait times for patients, but it's still unclear how it will all materialize. And lastly, funding for Obamacare was raised by levying taxes on certain healthcare industries like hospitals, insurance companies, and it's not clear if those taxes will get passed on to you and I, the consumer. But at the end of the day, Obamacare will insure millions of uninsured Americans, and that is both the promise of it and how much states comply to it and how much the public buys into it is obviously the variables we don't know right now. But day one, what was it, 3 million people?
I'm just looking at 3 million people to the HHS website, 10 million people to the New York State website.
Yeah, so basically some who don't have insurance will have it. The challenge is that of the 48 who are getting it from their employer, a lot of them are now going to pay a penalty because their health benefit is better. And they're going to get a whopping bill. So they're going to be pretty unhappy, and deservedly so. And then you have to ask, well, if we went through all this pain, how come there's still 20 million that don't get it? And that's a curiosity. Universal care is not going to be repealed. Obamacare needs to be changed.
I was just going to say that those are all things, Congressman, that can be fixed, repaired down the road, as the president has consistently said. What about the fact that you no longer have to answer the questions, is my understanding, about pre-existing conditions for the people that are now going to be picking up the insurance? What about the fact that they now have peace of mind that they don't have to always go to the emergency room for the most part for medical
But put
care.
a personal face on this, Dominic. You know that if you had to switch coverage here, you've openly talked about having diabetes.
Right.
You know, to
And
find
high
it-
blood pressure.
Right.
See,
To have a carrier.
I know no Republican that said you need to get rid of that provision. There were 4 or 5 that everybody agreed to.
But a lot of Republicans don't want the mechanisms that pay for it, that allow those things to be done. One of the things that the left hated about Obamacare is that it added some penalties and some fees to basically offset some of the expenses that insurance companies were going to face. You can't disallow people because of pre-existing conditions. The insurance company said, well, that's going to cost us an arm and a leg.
But you know what I'm confused about this is, and you're the perfect person to ask
you
about
don't
this.
need
Is
to be
this?
confused.
Well,
You're
this
not
is.
confused.
Oh, I am confused, because I didn't realize until the last week this plan, Obamacare, you want to call it, Senator Chafee. This was a Republican-originated concept. At the time, they came up with about half a dozen proposals, but a moderate Republican, later an independent. But this was a moderate Republican's plan for health care. Forget about Mitt Romney and what he put in place here. This is not some, Sandinista left-wing, socialist plan. This is a plan that was born out of, conceptually, it's almost like immigration we talk about. Bush's plan.
Don't get carried away here. I mean, yeah, there are a number of Republicans. I had a bill for universal coverage as well. But there are certain aspects. Saying that employers that are 50 or more have to provide health insurance means that some employers aren't going to have 50 employees. It means that some employees are going to work 30 hours a week. I mean, that's pretty much documented. And it's going to happen not because these are mean employers. They don't know how they stay in business otherwise. They don't know how they can provide this cost and still exist. So that's the challenge.
I think that's fair. But then the question becomes, say the president never uttered the words healthcare reform. We all agreed it was an unsustainable system that we were going on. 60 million Americans uninsured. My wife works in a hospital system. Any hospital you go to, they'll tell you what the emergency room was becoming, if not had already become. And some hospitals closed their door because they were never being reimbursed for care, and all of a sudden ERs are being treated like operating rooms here, or the place of first and last resort.
So
we had to do something.
The bottom line is Republicans should have come back and said, you won the election, this legislation's in play, but we need to make these following changes.
Well, give me what those changes for you, what would they be?
Well, one is his constituency of unionized labor, even if they have great health care, don't have to pay a penalty.
Okay.
That's one. Federal employees don't have to pay a penalty even though they have great health care. Congressmen don't have to pay a penalty. This is one thing.
So you'd widen the population that would have to pay in.
Everybody should have to pay. Everybody should be treated the same. Well, that's pretty huge. The issue of what employers have to do, I don't think that's sustainable.
But how do you get around that? I understand your point, and I think it's a legitimate point. You have an employer of a small company, make it up, Andrew, 55 employees,
well, it's 50.
right?
The threshold
right.
is 50.
So I'm saying 55, 50, whatever the number is. They're working on a small margin right now. If all of a sudden they have to be mandated that they have to give health coverage, for some of them, that margin is going to either drive them down, or like he said, they're going to make people part-time employees instead of full-time, so they'll get around that obligation. That's real. I still am confused. If you don't have that kind of a mandate, how do you get around it? I mean,
First of all, I question just how on the margin some of these businesses are. Some of them, legitimately, absolutely. But Ted Cruz, in his filibuster, mentioned White Castle. White Castle is not hurting for cash. And if they're knocking employees down to 29 hours a week so that they don't have to give them health care, shame on them. And I think that...
Wait. Shame on them for what?
For knocking down the hours that they're making their employees work and limiting their hours so that they don't have to pay them health care. Some companies have legitimate grievance, but some companies are doing it just to save a buck. And shame on them for not being better corporate citizens.
I know a major company that fired 40% of its employees. You could say shame on them. But 60 of them had jobs. And then as the company improved, they could start to hire more people. The reality is you can't repeal the law of supply and demand. If you're not making enough money, you can't add more expense to your company. That's the bottom line.
You could certainly. I mean, the other option is Medicare and Medicaid. Is expanding the government roles and allowing people in some of these companies that are on the margin to actually opt into the government plan.
I think one area which people disagree as to the extent of it, but I think instinctively the idea of malpractice reform. I think certainly it's been a bugaboo for the Democrats to touch it because of the legal lobby. That's a huge part of.
Huge.
Right, huge. I'm not minimizing, but they don't want to go as far as maybe some on the right of the Republican want. But there is somewhere that they can go.
Why did he bring that up? Why did he have to bring that up?
He's smarter than I am.
That's the first and the last time he'll ever say that. All right, when we come back here, we'll switch gears to politics. Some interesting movement, and if you're one Cory Booker, be a little nervous. And also, I'm still asking this question. We're in October now. Who exactly is Bill de Blasio? Maybe Mr. Carter can answer that question for me, because it's getting late early here, and I think there's still some unanswered questions that have to be resolved. Some politics around the region right after this.